Okay then, good afternoon Lagos and welcome on top of GNI on Go with Great Nigeria Insurance PLC, one of the Ogbonge leading insurance companies. We don't do for 60 years and still counting. They carry come your side every first 15 minutes for a package for PG level on Lagos Traffic Radio 96.1 FM.
Yes, and on top of this one, we take welcome everybody. I know say on top GNI on Go, we dey talk about your future insurance, how you go take make sure say your future is better and it's andagidigba. Now this one we take welcome everybody. My name na Temitope Peterside.
And of course, this afternoon we're going to look matters wey concern the benefits wey health insurance carry for head. We guys don't day for way in day to connect with us after this break. Micah Aruocha na my own name.
If you want big breaks, nothing's gonna stop you now. As long as you reach out with Great Nigeria Insurance PLC, your greatness is now. Conquer fear from losses or any form of hindrance from achieving your greatness. With a wealth of experience in insurance and financial matters, an array of life and general insurance products, motor insurance, fire and special perils, burglary, goods in transit, marine, and a lot more. For further information, please call 2341-342-9161 or send an email to info@greatnigeriaplc.com. Great Insurance PLC, for assured commitment.
All right, so we are Peterside now they join us and joining us this afternoon to feel make sense so that we all go feel sabi the benefit, the awoof wey full inside health insurance. We get Tayo Adesanya will be of GNI Healthcare Limited. Good afternoon, brotherly, and welcome to the show.
Good afternoon, my brother. I hear you. Well done.
I follow you too. Quickly, before we go enter with Yan, more let Lagos Sabi. Before this time, though, we give them updates of that eyewitness will be let us know say the accident wey shele for my 12 bridge will be follow one PSP truck and commercial bus as emergency responders. Now him don't rush go there, and we don't tell you now for free just before the end of Tomedis as we motorbike life reporter Raphael Jeremy take let us happy say they don't clear the accident for my 12 and everywhere don't they go say they don't whether again. So now just the backlog now remain in case you did that traffic. Just a bit waiting the shelle for there. And the one will be shelle this morning earlier for Lagos Ibadan Expressway in Wada Secretariat side. Big shout out to all the emergency responders who don't come out and that road it don't go city weather again in case you wonder waiting they happen for that road.
And from we live camera here everywhere we are eyes the touchlight this micro 10 minutes now better movement in and outside Lagos Ibadan Expressway, Lagos Abeokuta Expressway, everywhere now better movement this afternoon.
Okay, so time give us enough level to follow Tayo Adesanya relate benefits with the health insurance. First off, make we start like we do for classroom. Waiting be health insurance.
Well, health insurance just be like any other insurance, like motor insurance or fire insurance. You just want to insure for in case of eventuality. So health insurance is when you have access to hospitals, to healthcare at a subsidized rate. Yes.
Okay, you know it's in a PG program, so you go help us break down well. So what's be the difference? Somebody go to listen now and it go to look. So what's be the difference between health insurance and HMO, will be health management organization level?
Health insurance and HMO now basically are the same thing they talk about.
Good.
Are the same thing, no difference.
Okay, now you they talk about you talk say health insurance now that to get access to chicken money when you go hospital. When you talk about chicken money when you go hospital, say now the insurance company now ain't go make me pay the chicken money. I been at the hospital, make us understand how I go take benefit that chicken money.
So the benefit they for health insurance they give you, they say number one, you they save money on healthcare. Now if me now as a person now you can't go hospital, say you get malaria, they want to treat you. You get money where hospital will charge you, and when you pay that money, they call that out of pocket expenses. And hospital now will charge you, let's say 10,000 or 15,000, depends on the brand of the hospital.
Okay.
But if you come through us, through GNI insurance, because we have established relationship with most of these hospitals, what we are paying will definitely not be as much as go reach what you go pay.
Okay.
If they say now you go. So you are leveraging on our own relationship with the hospital. That is why now the money go pay, take get good access to medications.
Okay,
Healthcare.
Tayo, make me understand this one now. Now, I don't go hospital, I don't complain, they don't tell me say na 10,000 I go pay. So I no need to pay, or I if I get money I go
pay.
Now
if you deal with GNI, you don't need to pay any money.
I got to reach out to GNI.
Exactly.
Okay. Say I did so place and see waiting they happen. So now I go reach out to the hospital, or now go, because people where they listening now, they got to understand. Now go reach out to the hospital, say okay, this person our person the money now from us, so or now go send down to me, say take pay for the money where they say make you pay.
Okay, so as it's in the work now, they say if you want health insurance, you go come meet us, you go get relationship with you go sign agreement and everything, you go pay us chicken money, and then we go come reach out to the hospital, say okay, so and so person now our people, now our clients them be. Anytime they come to you, please attend to them. So the hospital will get your information. Now when you now need access to care, you go there, and then the hospital, because they have your records, they will attend to you, and you don't have to pay them any other money. Now we go count sort out hospital on our own.
Okay.
All right, make we let our people know, say they fit touchlight us on top of the show, but that one will be for WhatsApp alone, 0809 912 0777 0809 912 0777. Tayo Adesanya from GNI Healthcare Limited, we of course GNI HMO. Now they follow us relay this afternoon. On top, they are Wolf way day for health insurance. All right, so this question enter from this place, and in the talk say, help me ask GNI HMO how many hospitals they under their level, and shall I go pick the hospital where I want, no matter how expensive it be or how the matter they take be. Salami Toby, now they send that one come from Papa Shafa. So please help us. How many hospitals they for this package with you now?
So hospitals that we get, hospitals, dental clinics, eye clinics across, and investigations, a day over 1,000 across the nation.
For Nigeria?
For Nigeria.
Okay.
So if in that to be now, if he won't come have any agreement with us, we go give him a list of hospitals and then go pick from them.
Okay.
From them, yes.
Okay, so if the one will come near and pass, God be very far. No, say very far.
Okay.
What you go do? If you factor in the location.
If the one with the closest to them, they very far. Based on what we get, what we go come advice and we say, the one way they nearest to Ram, where he wants, if he can give us their name, we will approach them, have a relationship with them, and then they can have access, because proximity is very, very important to us in case of emergencies.
Especially when you get children for house.
Exactly.
Wow. So, but we go look, costs no get to do with anything, because if you, because of one man, create relationship with the hospital way near and pass, what about costing? How now they take charge for this kind of level, so that Pacific chocolate this kind of benefits where GNI HMO carry?
Of course, we have retail plan, we have corporate plan. The costing is definitely different, because for corporate plan, we have like a number of people. It's a pool. And of course, say insurance is my game of numbers now. So if now just one person, of course, the cost will be different from when it's like a corporate or a group of people.
Where they use that same hospital?
Yes.
Or we come meet to now? Which one?
Yes, where they come meet us now. If now about that hospital, definitely it doesn't matter whether it is one or two people.
Okay.
We definitely always have more people. So it don't really matter the number of people. It don't really matter.
So, but for people that we want to play this kind, I wolf the silver, the bronze, the whatever package where they, if now join body like association, like vulcanizers, then we come together, say okay, we hear say that they do for social association of hairdressers, we say one drum, we want touchlight healthcare for all we members. So how that one will take be? Because you just mentioned if now associations or if not just one person. I know say companies they do them for their staff also.
So for association, we go treat them as long as say more than.
And it go there cheaper.
Of course, it go there cheaper than just one person.
Okay.
It go there cheaper.
Okay, so make we look again. Make we see. Help us for the layman where they listen. Break them down. For instance, how much the lowest? Now, which of the package be the lowest?
We get as low as 15,000 for the whole year.
Wow, 15,000 naira.
For the whole
So
year.
if that person, that organizer, shoemaker, mechanic, where they listen to me now, and he knows say he always gets, some of us will be AA. Every month we must give to Caesar what is mosquitoes. We must give to Caesar what is mosquitoes. So that kind of person, 15K, what in he go fit your plate for if you go that hospital and shey na government hospital they talk or private here so that people go understand well.
Yes, we get government hospitals, but not private. We dey talk about.
Okay,
private.
So, all right. So 15K. How many times? How many times a year I fit visit? You know, say na AA we dey talk about.
Well, as much as possible. As much as possible. Yes.
If I go this week, I go 3 weeks time. Maybe something shook my enemy leg, and I don't want me tetanus enter. I can't go for tetanus injection. They no go talk say, but you just left 2 weeks ago for malaria.
You no matter, they will still attend to you.
That's nice.
Tayo, wait, because
nice.
I want to make us understand this thing. Now, you say 15K.
The lowest.
The lowest.
But surgery no follow that one.
I want to ask which kind, now every health issue, surgery, anything.
So,
now in that 15K we cover.
So remember as I talk, say, waiting be the lowest. Right? So basic health care, you get malaria, you get stomach pain, or you bruise your knee, you bruise your hand, all those kind of things.
Okay.
All those kind of things, yeah. So at least you go know say at least you no need to go pharmacy, go to use money to buy medication. The medication then they very expensive now.
3-5 for malaria medicine.
Okay.
That's so my brother.
And this package now for one person, I be for family, I be how this one take be? The lowest, this lowest package now.
This one now for one, that cost now for one person.
Oh, okay.
If now family of 4, family of 5.
So if not family of 4, family of 5, or family of 6, you say just do the multiplication.
Oh, 15 times. No discount.
So if you now look at the volume we are having, then we cannot talk about, if you can't talk about discount. Of course, discount today depends on the volume.
Okay.
Because already that 15K is now already discounted rate already.
Okay, so waiting no follow all these packages now. We don't talk about okay for minor something. Make we look. You don't talk 15K for the silver. So make we look the other amount where they and who it they for.
Sorry, come again.
The other packages where they and the amount and who be those where
category of people.
Okay, so if not to give all those other details, I would like I just drop numbers where people can call to make all those kind of inquiries.
All right, okay, go ahead.
Yeah, we will drop our number. So if you want to know more about our products and services and the plans and the coverage, please call 091 685 95956. I'll take that again. 091 685 95956. Another number we are not reach us for now 070 458 853 22. I'll take it again 070 458 853 22. Another number now 070 453 070 430.
You know what? Just take jejely and wayoli. You know say now na kuku pay for the time. No rush anywhere. Just take them small by small. Make we start afresh. I beg. The numbers.
I call the first one again.
Exactly.
091 685 95956. That's the first number. Okay. Second number now 070 458 853 22. That's the second number. Third number now 070 430 51516.
All right.
Make I call them again.
Oh, you don't think okay? Any other platform where people go feel rich now? Maybe in social media handles and all that.
Yeah, they can go to we have a page on Instagram and then on Facebook also. They can reach us the GNI Healthcare.
GNI healthcare. And if I won't come in the office and call, I won't come see now face to face. Make we talk the matter. Now, no say matter face to face. They sweet. Where have you reaching now?
No wala for that one. 28 Afolabi Aino Street, Ikeja, Allen.
28 Afolabi Aino Street, Ikeja, for back of what's it that back
Alade
of
Market.
Alade Market, exactly, for Allen there. All right then, nice one. So before we go come out, Adesanya, I go want make you sell the GNI healthcare and why we need this kind level for we health package again, just as we dey come out.
So why we need healthcare? We say number one, I don't talk before say we go save money. Number two, we say there's what they call medical emergency. When imagine say person they prepare for wedding now, and suddenly issue day, the money we supposed to take plan for a wedding. In the one kind of money now go they pay for emergency, or maybe person break hand and then he now has to use that money and divert it. But if person get health insurance, he go just deal with that medical emergency and still keep up with the project we want to do.
True.
So it's you go come out that burden of medical emergency. Another thing we say, with us, with our health insurance, you have access to a broad of hospitals, whether you did Lagos, whether you did Abuja, whether you did Benue, whether you did Port Harcourt, any hospital across the nation, you go to get access to those hospitals. But if you say you no get health insurance with us, that no be possible.
If I know them my usual location, no verse. If I know them my usual location and something happen,
yes, we go give you hospital where they for our network for that location where you did. For example, now you Lagos now go Abuja, you go work. You can't need to have access to care. We will give you a hospital where they for that location where you did for Abuja, so that you go free enter the hospital and then we'll treat you
at no extra cost.
At no extra cost.
This is nice.
At no extra cost.
Interesting.
So another thing we say preventive. They say prevention is better than
cure.
than care. So preventive care with us, you can always have routine checks. You can have screening, you know, and this also promotes early detection. You know, say if you don't get health insurance, normally first no fit just waka go hospital say you won't go do checks because you go on save money. Imagine nothing dey wrong with you just won't go do checks. How many Nigerians will afford that one? But if you did a scheme, you can do those routine checks. If you do screening, and that will come promote detection early. So if anything there at all, there'll be early detection, and then they go fit attack them, and that will also prevent further illnesses and a lot of casualties.
Make we leave am for here. You don't finish the matter. Thank you so much, Tayo Adesanya of GNI HMO, that na GNI Healthcare Limited. I say na office day for number waiting again for Afolabi Aino.
28 Afolabi Aino.
28 Afolabi Aino behind Alade Market for Allen Ikeja. Thank you so much. So if you join us on top of the show for this week on top GNI on Go.
Thank you, my brother. It's a privilege.
Welcome. And the sister said follow the year to avoid stories at church. All right, guys, that's all to reach for this week on GNI on Go. Next week, God willing, we will come back with another yarn where Great Nigerian Insurance PLC they make available. We go for this shaking break, and when we come back, we enter the place for the afternoon.
Who's coming back?
If you want big